Meet Diego, an avid marathon runner. He loves the thrill of competition and the breathtaking scenery that comes with long-distance races. During one of his runs, disaster strikes. Diego is forced to exit the race due to a painful calf cramp. After researching online, he concludes that dehydration was the culprit. Determined to never let his cramps ruin his passion again, he adopts a new mindset. Too much water is still not enough water. To prepare for future marathons, Diego begins drinking excessive amounts of water in the week leading up to his races, convinced that extreme hydration is the way to prevent cramps. However, just days before his next marathon, he starts experiencing headaches, bloating, and nausea. With race day approaching fast, he worries he might have to sit out again. What is wrong with me? Diego asks himself. I'm sure I am hydrated enough this time around, but I only feel worse than before. To answer Diego's question, he is suffering from water intoxication, scientifically known as hyponatremia. This condition occurs when excessive water consumption disrupts the body's electrolyte balance. Normally, sodium in the bloodstream helps maintain a balance of water inside and outside our cells, but when too much water is consumed, sodium levels become too diluted. Because of a process called the concentration gradient, water naturally moves from areas of low sodium concentration, which would be blood in this case, to areas of higher sodium concentration, which would be inside the cells in this case. This causes the cells to swell, which can lead to dangerous consequences. Swelling in the brain, also called intracranial pressure, can squeeze blood vessels and reduce oxygen flow. If it gets worse, it can press on important areas that control breathing and heart function, which can be life-threatening. Hyponatremia can start with mild symptoms like nausea, headaches, and bloating. The body may also try to get rid of the excess water by vomiting. If the swelling gets worse, it can cause confusion and seizures. In the most severe cases, it can lead to coma or death. Some people are more at risk for water intoxication because certain health conditions make it harder for their bodies to get rid of extra water or keep sodium levels balanced. One example is a condition called SIADH, a long name, but let's break it down. First, let's look at the word antidiuretic. Anti means against, di means across, and uretic means relating to urine. So antidiuretic hormone, or ADH, simply means it prevents urination, helping the body hold on to water. Normally, this is useful, but in SIADH, the body makes too much ADH. This causes the body to hold on to too much water, which dilutes the blood and lowers sodium levels, throwing off the body's electrolyte balance. But SIADH isn't the only condition that affects water balance. Other conditions can also make it harder for the body to remove excess water, like congestive heart failure, where the heart can't pump fluids properly, causing water retention and swelling. Or chronic kidney disease, where the kidneys struggle to filter and remove water, leading to fluid buildup. The kidneys of a healthy adult can excrete approximately 0.8 to 1 liter of water per hour. Consuming more water than this can overwhelm the kidney's excretion ability, potentially leading to water intoxication. Unfortunately, there is a lack of statistical data that can determine the exact amount of water one consumes in a specific amount of time. As of right now, we know the amount will vary per person, but it is estimated that after consuming 3 to 4 liters of water in a few hours, hyponatremia symptoms begin to appear. An example of this was seen in a 2013 case study about water intoxication and prolonged hyponatremia conducted by Yamashiro and others, where they treated a 22-year-old man who did not have a history of mental illness that drank 6 liters or about 24 cups of water over a 3-hour period. Shortly after, he showed symptoms such as restlessness, odd behavior, and rapid uncontrollable muscle contractions, similar to that of a seizure. Since Diego is already showing symptoms of hyponatremia, let's talk about how it's treated. It's important he seeks immediate medical care so they can monitor his bodily fluid levels and have the resources to provide necessary interventions. Typically, the goal of treatment is restoring your sodium levels and reducing your water levels. In the case of the 22-year-old man who drank 6 liters in 3 hours, He received a treatment plan of saline infusion, where salt is manually transferred into your body to restore sodium levels in your bloodstream, furosemide, a drug that when taken helps you pee when your kidneys aren't working properly, and dexamethasone, a drug that when taken tells your body to keep sodium, further balancing the water and salt in your body. Thankfully, after a week of treatment in the hospital, Diego returned home without any additional physical or mental problems. Next time, Diego needs to conduct better research to obtain more accurate and reliable evidence. His issue wasn't dehydration, it was misinformation. Diego's earlier mindset of too much water is still not enough water was debunked by a study in 2006 written by Angus Whitfield, discussing the dangers of water intoxication in endurance sport. They concluded that excessive hydration before and during an event is not necessary for performance. The idea of overhydration being beneficial comes from a misinterpretation of a 1969 study, which simply found that consuming some fluids improved performance compared to none. Instead of immediately adopting a new hydration strategy, Diego should have learned about the body's recommended water intake. While it can vary based on factors such as age, sex, activity levels, and climate, it will generally fall around 3.7 liters or about 13 cups of water intake per day for men, and 2.7 liters or about 9 cups of water intake per day for women. This means that the 22-year-old patient mentioned earlier drank roughly 2 times the daily recommended intake of water within 3 hours. With this new knowledge, Diego can now adopt new hydration methods to better prepare for his next marathon, but most importantly, prevent experiencing hyponatremia again. For starters, Diego should trust his body's natural thirst cues and drink accordingly, rather than following rigid hydration rules. However, when engaging in prolonged physical activity or heavy sweating, Diego should turn to electrolyte drinks like Gatorade, Pedialyte, and coconut water, as they provide hydration while replacing important minerals like sodium and potassium that is lost with sweat. Sodium and potassium are common minerals found in electrolyte drinks because of their essential functions in the body. Specifically, sodium helps control the amount of fluid in the body, while potassium helps your cells, heart, and muscles work properly. In conclusion, hyponatremia is no joke. While the evidence and statistics seem to describe this condition as extreme and unlikely for the average person to experience, we believe it is important to be aware of the extremes, as the media only conveys the minimum amount of water necessary for an individual per day. With more precautions when conducting research, new knowledge acquired, and new hydration strategies, Diego is now prepared to begin his return to marathon journey.